Okay, so I'd like to welcome everyone to our monthly webinar in June. Hello, Dr. Ceja. Welcome.
Hello, thank you.
Thank you for taking time to join us. We will get started in a minute since I'm waiting for a few more people to join. As far as our regular raffle that we give almost 50%, actually not almost, for Dr. Ceja Gastric Sleeve is 50% off of the package price, which is $2,000 off. All you have to do is have submitted or submit a health questionnaire on our website by going to MexicoBariatricCenter.com. And Dr. Ceja would be the surgeon of your choice. And we would release the Zoom poll at one time. And you guys need to answer those few questions and watch the webinar to the end. And that's all it takes to be eligible for participating in the raffle at the end of the webinar. Like I said, this is our monthly webinar. We've been educating patients about the benefits of weight loss surgery, the types of weight loss surgery, and what medical tourism MBC does for years now. I remember in 2015, we started going to Texas. And since then, we've been doing seminars and webinars all over the country in US and Canada. So we would get started. Just a little bit about me. I've been in the medical tourism industry in Mexico since 2007. I have traveled to all points of interest for medical tourists in Mexico. And right now, our major operation is in Tijuana. That's where we focused. We started our own hospital in last year, 24, and it's been very successful. We started offering not only bariatric surgery, plastics, post-bariatric patients for skin removals, and we offering so many other services like hysterectomy, endometriosis for women's health, and we constantly offering new procedures like we call it Get Sassy with Sassy. Dr. Jackie offered that recently. We are very unique in the services that we offer. Our blog post is constantly, we publish new articles. So it's always good to go MexicoBariatricCenter.com and see what's the latest and greatest. We are going to go to New Zealand in November 21st and have a few seminars in New Zealand. We have a group going in September and probably December or January. Vanessa is taking patients down there. So again, our blog posts are always up to date, so check it out. We try to cover most of the questions that most patients have. And if you paid attention and you didn't hear your questions answered during the webinar, please go ahead and post it in the Q&A tab, and we will answer it at the end when we're done with all the material. So just the topics today, we'll talk about obesity, its risks. We talk about what does weight loss surgery do, what's the difference between weight loss surgery and exercise, diet, and the new type of medications like Ozempic We talk about our hospital. Like I mentioned, we just started our own hospital last year, how to schedule, what the packages cover, and we talk about different ways that we support patients from pre-op to post-op. Dr. Ceja would take over at that point and talk about the inner working of procedures that we offer from laparoscopic to endoscopic, from revisional to reversal, and all spectrum of procedures that we offer. Then I would touch on based on financing, if you need, and another plus that we offer is an optional medical tourism insurance MTI. That is a huge part of the package. And we try to finish there, start the Q&A session. And at the end, when we're done, we would try to do the raffle at the end. We try to do the webinar under 2 hours. If we don't get to all the questions, you can always circle back, ask us by calling us, emailing your coordinator. Every patient, once you submit your health questionnaire, gets assigned to a coordinator, like a dedicated case manager, and that person will be dealing with your file. So you don't have to, they're familiar with your case. Every time you call or text or email, you don't have to explain. Everything is in your file. We all know what obesity is. Basically, our bodies are not used to the ultra-processed food, sugary drinks, and inactive lifestyle. And that's what's happening in worldwide, that we see we're gaining weight and is becoming epidemic, pandemic situation for obesity. In the medical field, there is a formula that very simply you put your height and weight and it gives you a number which we call body mass index, BMI. And based on that BMI, you kind of sort of categorize in this chart whether you're under 25, which is normal, 25 to 30 is about getting to overweight, and after that is considered obese. Of course, we would show you like a chart that how to really accurately see where you are, because we all have different shapes, different body type based on male, female. You know, some people have larger frames, bigger bones, but in general, this is the cutoff. So we do surgeries anything above 28, usually 30, depends on your situation. We have surgeons that take a little under 30 based on your HQ, and we go all the way to BMI of 110. We don't have any limit of what we can handle in our hospital. I was mentioning about the accurate way to look at your weight. If you look at the chart on my right side of the screen, you see based on being female or male and your body frame size, a small, medium, and large, and your height, you can kind of tell where your ideal weight is supposed to be. And then the question always comes like, okay, when I get gastric sleeve or bypass or DS or even endoscopic procedures, how much do I lose? That's a good question. Usually in the literature, they tell you like the percentage of extra body weight. Like you say, oh, 70% of extra body weight or 80% of extra body weight. But those are all average too. Depends on your age, your genetic, your lifestyle, how good you do pre-op and post-op, how you stay with being active. So all that determines the percentage of weight you lose. In our patients, we'll see later like how much they don't get to their goal weight. Very small percentage, but most of the patients that we have are getting all the extra weight up. So now to see, like, let's say if a lady with a height of 5'4" with a medium size, the ideal weight is 120. If this person weighs 220, it has 100 pounds of extra. Well, now when we say 70% of extra weight loss, that means they're going to lose 70 pounds. So their weight post-op after a year, 2 years, it will be around 150. But again, depends on how you do deal with your pre-op and post-op and lifestyle. You can lose all the extra weight. So that person can literally go to 120 pounds, which is your goal ideal weight. Again, the obesity comes from the increased nutrient content of the food, lack of physical activities, right? We all sit down, we watch TV, at work we sit down, we get in our car, drive to work, drive to home, no activity there, comfort eating, stress eating, lack of sleep, the drugs that we take, all are contributing. So talking about fat cells or so-called adipose tissues, right? So when we gain weight, not only our fat cells increase the numbers and size, they change, their structural change happens. And if you look at a lean adipose tissue of a lean person on the left, comparing to the person on the right, you see that the chemical, the structure of the fat cells are different. And that is causing all sort of problems, right? Diabetes type 2, which is insensitivity to insulin, to leptin, to therapies, to vaccination. Even people who are obese, are the protein and exercise are not, their muscles are not responsive. It's a situation like when we get old, our body don't respond to protein and exercise. But this happens in an individual with obesity. Okay, so this obesity is a major risk factor. 40% of adults in US alone are dealing with this problem. And these are the side effects. We already know the heart problems, lung problems, stroke, diabetes, immune system problem, chronic inflammation, certain type of cancers. And this was shown to us when we went through COVID era with coronavirus, right? Coronavirus it does attach to the fat cells. The more fat cells we have, the worse situation. And we end up in the hospital, we end up in ICU, and we have a higher chance of dying. And that's why people starting to choose healthier ways to live, healthier lifestyle, healthier food. But we still have that problem. Okay, so diet and exercise. We always have to eat healthy, regardless, and be active. So, but for obesity, that is not a long-term solution. Now let's talk about pharmaceuticals. Since the beginning of human history, we tried to come up with a pill, in this case, an injection, that we can take and be a magic, and we lose weight. And that's the Ozempic is a great medical breakthrough, but still is not a proven long-term solution. If we stop taking them, we're going to gain the weight back and more. And we would talk about the mechanism that is involved. So at this point, bariatrics is a gold standard, is a long-term solution for obesity, is quick, safe, and is a sustainable solution. Okay, so again, if we want to resolve our health problem with obesity by doing a diet and exercise, all we're doing is body is going to resist against it and we regain the weight back. And the reason is bariatric surgery is so successful because it resets our metabolic set point. Our metabolic system gets recalibrated, which means we get a fresh start in life by going through bariatric surgery. And if you consider, let's say if I weigh 250, my brain, which means my brain and gut hormones are interacting at that weight and is used to that brain or body's thermostat. And the minute I start going on diet and exercise and lose weight, is going to resist by increasing my hunger and reducing my metabolism. It wants to bring me back to 250 weight, 250 pounds. With the bariatric surgery, however, the minute you wake up from the surgery, your brain sees you at a different weight. So the interaction, that's what we say, metabolic system recalibration. So it's a magic, right? Because of the hormonal changes, all of a sudden, your hunger goes down and your metabolism goes up. And this is what the researchers found out, right? Because they didn't know what's causing such a rapid, sustainable weight loss. And now they're looking at it. And if you look at the right side of the screen, you see all the known hormones that are changed with bariatric surgery, right? From ghrelin, which is a hunger hormone, to all GLP-1, GIP, CCK, PYY, all these are changed because it cuts the stomach and the intestine. Now, years ago, they started coming up. They said, okay, so if GLP-1 is one of the naturally occurring hormones in the bariatric metabolic procedures, let's give a shot of GLP-1 to patients. GLP-1, by the way, is a synthetic hormone that imitates the hormone that is naturally occurring in the case of bariatric surgery. But its external injection is not naturally occurring. And the minute you stop putting the GLP-1 in, you would lose the momentum, start gaining the weight back. As a matter of fact, new data shows that 70% of people who use Ozempic, Mounjaro, all the Wegovy, the more like what do you call it, customized injections that are for weight loss surgery, they go back to stop because of the stomach issues, because of reduced craving control, and as you see the side effects, it can create cancer, it can create vision loss, it does, you lose muscle mass more than you would do with bariatric surgery. So these are all the side effects, and it's expensive too. So why not do the real thing, which is bariatric surgery, which they're trying to imitate with drugs? Okay, so if you look at this as like a pyramid, right? Diet and exercise are good for only a very small portion of the population. And then it comes semaglutide injections, like I mentioned, Ozempic, Wegovy, Mounjaro, and more. There are some more medications coming as we speak. But again, that only works, these are great, but it only works for a certain portion of the population. Then it becomes endoscopic procedure, which Dr. Ceja is going to talk about, like gastric balloon, endosleeve, ESG, and bariatric surgery like gastric sleeve and bypass and TS. Those are gold standard. So we are like the last resort for people who are not insured or underinsured, or to be honest with you, to get a better medical care. It was a time that people go to Mexico years ago because they didn't have insurance and the out-of-pocket fees in US was so stiff. But now it's a reversal. We do surgeries that the surgeons can't even do in US or Canada for that matter. You not only save a lot of money, you're also getting a better medical care. This has been said by 50%, more than 50% of our patients are either nurses or they're somehow in the healthcare industry. So they know when they come see our hospital, the care that we give them, they know the difference. And those are the ones are a testimonial for us to show that we're doing a better job than is done in the US. And you'll see, for example, the surgeons we have, like Dr. Ceja, they're very young. Remember, this is hand-eye coordination is done laparoscopically with, like, let's say 5,000 procedures behind them. These are young surgeons that are experienced dealing with all sorts of different revisions and different type of bodies and different type of health problems with patients. Again, if you look at CDC, the CDC strongly promotes the medical tourism companies like us to go through because we choose top-rated hospitals. We choose top-rated surgeons. We offer the driving, the hotel reservation, all that stuff, peace of mind. And for $99, you can buy MTI, which I would cover later, that covers the complication, if you have any. So Mexico Bariatric Center, MBC, it was founded in 2012. Like I mentioned, I started in the industry in 2007, but I started MBC 2012. We are a US-based corporation. Our office, I'm actually from our office in Sacramento, Folsom, Sacramento. Dr. Ceja is joining me from our Hospital Azar in Tijuana. And since inception, our goal has been providing top quality, affordable procedures to patients who need them most. You can think of MBC like we have standardized this industry. We are regulating the bariatric surgery in Mexico because all the companies that are following us, they're trying to be MBC for a reason. They're all like lookalike, copycat, but they cannot be MBC because we have been in business for so many years. As of January of 2025, we have done over 27,000 successful surgeries. Remember, these are not just numbers we're throwing around. We are probably one of the biggest or the most affluent centers in the world with the number of surgeons we have, with the number of surgeries we do. And we work with the top 5 quality surgeons in Mexico. There are so many reasons I can give you. We would see a bulleted point of all of it, but these are like the highlight of why I choose MBC. The top surgeons, most of them are double board certified. The years in business, the number of reviews, the quality medical care, the treatment you get there. One of the pluses that we do is we manage our surgeons' load day to day, and we cap their surgeries at a certain level so they don't get exhausted. They get ample time of off time. That's one of the reasons that our surgery is so low complication and is so successful. That's one of the reasons. You see, like we talked about the copycats, right? A lot of companies come in and they do advertisement, they do little cute TikTok ads. They're trying to show that, hey, come with us. But you need to look at, are these assistant surgeons that just started their own company, or they are experienced surgeons that have been in business with a company like MBC that can handle complex surgeries? They have the experience, they have the knowledge, they have the background. And I always compare pilots with surgeons. Do you fly with a pilot that has only 200 hours of flight time? Or you want a flight with a pilot that has 10 years with 10,000 hours of flight time? Yes, most of the time, nothing happens. But it would just be that one time that you really need that experienced surgeon to save lives. We talked about the power of social media is great, but you also have to read between the lines and read what is behind all the cute stuff on Instagram or TikTok is doing, right? Do they have a website or do they have credential? Who is behind the company? Is this just a website that just bunch of assistant surgeon is running, and or it has to do with a real organization like NBC? I like to show. Let's show this a little demo of our hospital. So we talked about why NBC. Hospital Azar is built around patients who are medical tourists, go down there to get surgery for bariatrics, plastics, and minimally invasive procedures like gynecology and things like that. So this, the name is coming. I named Hospital Azar after my mother. Is a tribute to my mother, and it's 3 floors of over 40 plus beds, 4 operating rooms, 6 recovery beds, and it's made from the best of the best material and equipment. And from sterilization to the OR to everything is top of the line, is one of the top centers right now in Tijuana. And again, this is not a hospital that takes emergency walk-in or things like that. This is made for you guys. When you go down there, it's made for your convenience, for your well-being, for the best experience. After COVID, we stopped taking patients, companion to stay with them, but now we opened it up. So for companion, we have option for them to stay in the hospital. Of course, the first night, you stay with your companion anyway, whether you're in the hospital or hotel. But your companion has option to stay with you in Hospital Azar or stay in our hotel. Usually we use Hyatt, we will see that. You have visiting hours, and You could literally see Hyatt from the hospital. And if you can go to like the second floor, you can see the hospital from Hyatt. So it's that close. We have transportation, but you can easily walk, just so it's very convenient. We talked about why MBC. Our MBC process, from the time you contact us, from the time you get on the calendar, is very simple. It's 3 steps. Step 1, 2, 3. You fill out the health questionnaire like I asked. Everybody needs to have a health questionnaire today to be eligible for the raffle. You choose the surgeon or the type of surgery you want. If you don't, we would assign you the best fit for you. You pay the deposit. You can actually book yourself with the link that we send you after your approval. Then you're on the calendar. All you have to do is arrange for your flight or drive to our center or to San Diego International Airport. So you finish your paperwork and you're done. You're on the way down there. These are our all-inclusive packages I talked about, right? It covers the surgeon fee, hotel fee, hospital fee, the pre-op, post-op test, medications. So we have actually a nutritionist in our staff, in our office in Folsom, Sacramento. Private, you get dedicated transportation. These people have been working with us over years. They're the best. So I have a surgeon liaison. You're going to see what the role of surgeon liaison is. And you would see what the medical tourism insurance covers. We have few Facebook groups for you to join. There is the biggest group we have, which is for our past patients. We have another group, which we call Inside Group, those people who submit the HQ, but they're not really booked yet. They're on the fence. You get support from not only us, from your buddies, your surgical buddies who are constantly sharing information of how they're experiencing after surgery. They put pictures before, after pictures. This is a great support for you. We have so many ways that we support you before and after. Not only we do webinars every month on the first Saturday of the month, usually. We do have surgeons Q&A every Wednesday, 10 to 10:30 Pacific time. You have a chance to get on the Facebook, ask questions. Our coordinators go live, our nutritionists go live. We have so many ways that we support you. And look, this is only the team of past patients that are supporting us day to day. Actually, we just added one more person. This is just a list of past patients that are so passionate about us that they love to dedicate their career, their post-op life to us. Sarita, Rena, Jamie, Kelly, Laura, Tiffany, Anna, Vanessa is our coordinator in New Zealand. Anna is in Canada. So this is the type of support you're getting. We do podcasts. Sarita and Rena do podcasts. I highly suggest that you watch that. Another success so contributing to our success is the way we handle your HQ, your health questionnaire. When it comes, first of all, we have complex routines software that we have developed over time to match you originally with the best surgeon. And Our surgeon liaison, which is another physician sitting looking over every HQ that comes to our system and goes to the surgeon. And they assign to that surgeon, surgeon reviews it, goes back to the surgeon liaison, goes back to the coordinator, goes back to you. So this is a complex system that we handle your health questionnaire. And we make sure you get the proper attention, proper consultation. You still have a chance when you go down there to talk to the surgeon, of course. But this is how we get started with you. Try to find this system anywhere else. As I mentioned, we use Hyatt Place for our patients for stay, for their companion. Our pre-op diet is very simple. Based on your BMI, you're required to do anything from 2 days to several weeks. The better you do on your pre-op diet, the more dedicated you are to the pre-op diet, the more success you're going to have. So no matter what your BMI is, when you start doing a good job on your pre-op diet, it's not only easier on you going through the surgery operation, post-op recovery, it's easier on the surgeon. Smoking. Again, for a very simple, you just have to do a 2-day clear liquid, and then it goes from there. As far as medications, please stop any blood thinner NSAID at least a week before. If you're taking Ozempic or Wegovy, Mounjaro, or any of those, 3 weeks to stop before the surgery. Smoking, big time, before and after. These are helping you to do better before, better after, better recovery, better outcome. So the better you do, the better your outcome. And of course, we will tell you all the instructions. If you're taking any medication, by the way, on a regular basis, just take the bottle with you to Mexico, to Tijuana. We want you to arrive anytime before noon, so we have enough time to do the pre-op diet, pre-op test, and we want you to depart 2 p.m. or little after. Not too much, because then you will be waiting too long to departure. You also can come a day early or leave a day later by staying whether with us in Mexico or staying in the San Diego side. We have a deal with Hampton Inn that if you mention Mexico Bariatric Center, they give you a special rate. The day of the surgery, of course, it's very simple. Just if you stayed in the hospital, you're just there, bang. They prepare you, they take you to the OR area. If you're not, you show up in the lobby, they pick you up, they take you to the hospital. You stay in the hospital, depends on the type of surgery you get. By the way, we don't shortcut that. It's huge to stay in the hospital for recovery. That was talking about why go to Mexico. In US, they're trying to make this as an outpatient surgery, which means that they want to release you as soon as possible, because there's a difference between an ambulatory hospital and a regular hospital, right? They can't, it's ambulatory hospital is you can't stay long after surgery, and it's cheaper, and they're trying to cut corners so they can save money. But you actually stay with nurses, with our staff around, with doctors, internists, the surgeon team, to watch over you until we make sure you recovered well to go back. We do multiple tests for leak, for things like that. And we make sure you're good to go back. Again, on the day of travel, they take you, we do use medical pass to shorten the wait time to cross the border. Of course, you know, this is a border. A lot of times we don't have no control, but our drivers are experienced. We know how to handle different situations, so you're good. Post-op diet is, again, another big factor in your recovery, your results post-op. You go from a clear liquid to solid in 4 phases in about 4 weeks, like a month. You know, if you have any medical questions after surgery or before, you contact Jen at Mexico Bariatric Center. Nutrition, you can contact Natalie. For general inquiries, you contact Sarita. So there's so many points of contact that you can talk to us before and after. When you're done with your surgery, it's not like, oh, we're done with you, we're not going to cover any support for you. We do cover that. We were talking about the percentage of weight loss, and one thing I mentioned was in the literature, they tell you this is the average of weight loss. Look at the average of weight loss with our patients. It's above average. Sleeve, and this is only, by the way, 18 months. You're still losing weight to 24 months. So 18 months, sleeve average weight loss, 74% of excess weight loss. Bypass, 80. Mini bypass, 81. And duodenal switch, 86%. And this is another way to look at the difference between gastric balloon, ESG, sleeve, Roux-en-Y bypass, mini gastric bypass in the 18 months. Here's another statistics. We only have 5% of our patients return for revisional surgeries. In US, in the published statistics shows 15%. That's how well our surgeons are doing their work. Anybody can say, well, I give you a gastric sleeve, but how tight they make it or how loose they make it, how they cut the stomach, this is all based on experience, skill of the surgeon. So you see the reason for bariatric surgery revision: 74 insufficient weight, 14% complication, and 12% between complication and insufficient weight loss. Okay, so at this point, I want to, I don't have to introduce Dr. Ceja. He's a well-known surgeon. These surgeons are well-known internationally, but just a little bit about him. He's double board certified. He's been working with us only since 2017, I believe. These surgeons, all of them, including him, they attend all the international and national congresses to make sure they're up to date with the latest and greatest technology. So here, I let Dr. Ceja start talking about the different procedures we offer and explain each one. And then after that, I take over. Dr. Ceja, thank you so much. I will let you take over from.
Hello, everyone. I'm Dr. Ceja. Today, we will explore the different options available for bariatric surgery. These include both surgical and endoscopic procedures. The most commonly performed are gastric sleeve and gastric bypass. The best option depends on each individual's weight and obesity-related conditions. Endoscopic procedures are an alternative for patients specifically with a lower BMI. This is the types of procedure that we offer in Mexico Bariatric Center. Next, please. Next. The gastric sleeve surgery. This is the most commonly performed bariatric surgery worldwide. Approximately 80 to 85% of the stomach is removed through 1 to 5 small incisions. It works in two main ways. First, restriction. It limits the amount of food a person can consume. And the second, hormonal changes. It removes over 90% of the hunger hormone, ghrelin, while increasing GLP-1 and PYY, hormones that improve glucose control in patients with diabetes. Advantages. With procedure around 1 hour, maybe less, and short recovery time. High success rate for weight loss. Improvement in obesity-related conditions like diabetes, anemia, and high blood pressure, and no changes to intestinal anatomy. Disadvantages may worsen acid reflux symptoms. Is an irreversible procedure. Expected weight loss around 72% of excess body weight. You stay in the hospital 2 nights, and recovery time after surgery in average 2 weeks. Next, please. Single incision gastric sleeve is very similar results in comparison with the gastric sleeve, traditional gastric sleeve. This surgery is performed through a single incision at the belly button. It requires advanced surgical skills and offers the same outcomes as traditional gastric sleeve. The changes hormone is the same, reduces ghrelin levels more 90% and increases GLP-1 and PYY. The main benefits are 2. First, better cosmetic outcome, minimal scarring, and the other is faster recovery. The duration is a little more in comparison with the gastric sleeve conventional, 1 hour and a half, 2 nights in the hospital, and recovery is very similar, 2 weeks, maybe 1 week is enough. Next, please. Next. The endoscopic gastric sleeve is a non-surgical procedure, incision-free, performed through the mouth using an endoscope. It is a purely restrictive procedure, no hormonal or absorptive changes. Average weight loss in this procedure is 40% of excess weight, sometimes is less, significantly lower than the laparoscopic sleeve. Recommended for patients with lower BMI or patients with high surgical risk. Advantages is often reversible, no external incisions, and very quick recovery. Disadvantages, limited weight loss and risk of ulcers due to sutures. The duration about the procedure is 30 minutes, 1 night in the hospital, and recovery 1 week is enough. Next, please. In this procedure, the gastric bypass RNY creates a small stomach pouch connected directly to the small intestine, bypassing a portion of both the stomach and intestine. This is a mixed procedure. limits food intake and nutrient absorption. It increases GLP-1, a key hormone in diabetes control, considered the gold standard for treating morbid obesity. The benefits: improves diabetes and high blood pressure in up to 80% of the patients. Best option for patients with severe acid reflux. Main disadvantages: risk of dumping syndrome, high risk of gastric ulcers due to direct connection between stomach and intestine. The surgery time is 2 hours average, hospital 3 nights, and recovery after the surgery 2 weeks is enough. Maybe in some patients, depends the job, maybe more, 3 to 4 weeks. The average 1 year excess weight loss is approximately 75%. Next, please. This comparison chart highlights the advantages of each procedure. Every patient must be individually evaluated to determine the best option. For example, for a patient with severe reflux, the gastric bypass is typically the best choice. About the BMI, patients with BMI 30-40s is enough a gastric sleeve. Patient with a little more BMI is better gastric bypass. The other thing is very similar, only in the gastric bypass is more common the ulcers because the connection between stomach and intestine. Next, please. Mini gastric bypass. This procedure involves creating a small gastric pouch and connecting it to a small intestine with just one anastomosis. This is the main difference between mini gastric bypass and gastric bypass RY. Expected weight loss is around 76% of excess weight, very effective in controlling diabetes and hypertension. It's an excellent revision option when a previous gastric sleeve is no longer effective. Main disadvantages: this is possible risk or bile reflux, but it's very uncommon, less than 5%. Surgery time, 1.5 hours. Recovery and hospital stay is very similar to gastric bypass RNY. The expected weight loss is around 76%. Next, please. This chart compares key aspects of gastric bypass and mini gastric bypass. The results about the weight loss is really similar. Only in the gastric bypass is more common ulcers because in this case we do 2 anastomosis, but in comparison with improve the other diseases related to obesity is very similar, is very effective in both procedures. If the patient have acid reflux, it's better gastric bypass RNY, but mini gastric bypass can be helped the other patients with acid reflux. Next, please. The SASIS is a new procedure with excellent results. It combines a gastric sleeve with a connection between the stomach and the ileum. It's a portion, the distal portion of the small intestine. Compared with other malabsorptive surgeries, this procedure reduces the risk of malnutrition. It enhances production of GLP-1 and PYY, similar to gastric bypass, and positively influences to the gut microbiome, improving metabolic diseases like diabetes and apnea or other diseases related to obesity. Advantages: over 75% excess weight loss, reduction to revision after gastric sleeve, or patient with lab band previous, single anastomosis equals lower risk of ulcer. It's very similar to effective in comparison with the mini gastric bypass. Surgery time, 2 hours average. High success rate with lower malnutrition risk. I consider this is a new procedure, but really, really very effective. It's a good option. Next, please. Duodenal switch. This is a combination procedure, restrictive and malabsorptive. It is a complex but highly effective. It's the most effective that in comparison with other procedures, malabsorptive, and strong long-term results. Benefits up to 80% excess weight loss in the first year. This is very great. Diabetes remission in over 90% of patients. Very high metabolic effect, and up to 95% total excess weight loss until 2 years after surgery. Main disadvantage, high risk or malnutrition. This is a very strong malnutrition procedure. Requires lifelong vitamin supplementation and regular blood test monitoring. Surgery time around 3 hours. Hospital stay 3 nights and recovery 3 to 4 weeks. Next, please. This is a comparison between the two types, duodenal switch BPD or duodenal switch type Harris. The results in comparison both is very similar, is very effective both, and particularly for me is best option Harris because it's quick and very effective to improve diseases related to obesity like diabetes and high blood pressure. Next, please. Revision surgery. This is a corrective procedure for patients who didn't achieve the desired weight loss, regain weight, or experiences complication after bariatric surgery previous. In this case, we offer different options. For example, if the patient have lap band, can we perform 2 gastric sleeve, gastric bypass underwire, mini gastric bypass, SASIS, or duodenal switch. The gastric sleeve is practically the same procedure we can offer: re-sleeve, gastric bypass, duodenal switch, SASIS. After the gastric bypass, the options are different. For example, can be offered revision gastric bypass, other procedure, endoscopic procedure, for example, TOR, and revision gastric bypass to duodenal switch. The expect weight loss is around 72%. The duration of surgery, it depends what type of surgery will be performed. For example, gastric sleeve to gastric bypass around 2 hours, but if the procedure is gastric bypass revision, around 3 hours. Hospital, it depends what type of procedure we will do, and average 2 nights or 3 nights. Recovery, it depends on the procedure, 1 week to 4 weeks. Next, please. If you have hiatal hernia during the surgery, it's very important that you know we repair the hernia in all patients that have this problem, because you can develop acid reflux if the hernia isn't repaired. It's very frequently, approximately 1 in 3 bariatric patients has hiatal hernia. In general, it's very small hernias, but it's necessary repair. If you have a history of GERD or a big hernia, is very important. You know, the best procedure is a gastric bypass RMY. Okay. Next, please. Bariatric surgery can improve the symptoms of PCOS, particularly in women with obesity. The benefits with this type of surgery in this patient is more regular menstrual cycles, reduce hirsutism, improve fertility, and better quality of life overall. Numerous weight loss surgery patients of Mexico Bariatric Center with PCOS have been cured and overcome infertility. How fast can you return to work after bariatric surgery? It depends every patient and job type do you have, but in average, it's in general 2 weeks. For example, if your job is in the office and you have a gastric sleeve, maybe 1 week is enough. But if you have duodenal switch, it's necessary 2 or 3 weeks. If you have is more hard, it's necessary more weeks. For example, gastric sleeve, 4 weeks, mini gastric bypass or gastric bypass. Sometimes it's necessary 6 or 8 weeks, but this is the most common 2 weeks. That's enough. Next.
Thank you so much, Dr. Ceja. I would talk about cosmetic a little bit. As I mentioned, we offer plastics and cosmetics surgery. We mainly, our focus is our past patients. And remember, the plastic surgeon that can handle post-bariatric surgeon patients are different. They need to have a different background, different experience. However, we can do all types of plastic surgeries, from facelift to tummy tuck, mummy makeover, which is a very popular procedure right now. Basically, all it is when you combine several procedures like tummy tuck, breast lift, and maybe arm lift, it's called mummy makeover. Arm lift, thigh lift is very common. Again, we do hysterectomy, endometriosis. Now, something that you have to again be mindful of is, first of all, do your research. Like I mentioned, we are regulating the industry by watching over the surgeons, watching over what is done. Like, one of the factors that we're looking into is the number of hours that the patient is under anesthesia. We try to limit that, minimize that by not doing too many procedures. Sometimes places offer you too many procedures in one. It may not be a good idea. I know everyone wants to go one time and get it done, but remember, it's your well-being, is your health, is your life. Also, one thing else that, like, the pluses to go with us is all packages, again, are all inclusive. And we keep you 2 nights, most of the time, 2 nights in the hospital. And sometimes you have option to stay longer. Recovery is a huge part of plastic surgery. And you need to make sure your recovery is done right. The wounds, the scars are being taken care of, not only just short term, but long term as well. So we do have plastic webinars separately, but this was just quick review of what we do. Again, we do all women's health endoscopically. We do diagnosis for endometriosis, hysterectomy, all that. As far as the financing, these are the payment options we take. Of course, cashier's check, Zelle, credit card. Some of the FSA, HSA, we are capable of taking, not all. You can do a loan against your 401k retirement plan. Or if you have a relationship with your bank, maybe that's a good idea to go to them first. If not, then you have other options like we offer super money. It's the links on our website, e-financing, and other places like SoFi. But don't apply to too many places at one time, because it would hurt your credit score. Also, remember to another program we have is once you pay the deposit, you can start making payments until your surgery. Your surgery payments are due 15 days prior to the surgery. At that point, you have to either, let's say if you're taking a cashier check with you, just send a picture of the cashier check, a clear picture of the cashier check, or pay however you want to pay, but it needs to be paid so we can complete your file. Something I always say that, like, we reserve these places ahead of time. Remember, there's a lot of coordination and facilitation coming into picture for your seamless experience. So you need to help us to make your experience seamless. The sooner you do the paperwork, the sooner you make the payment, the sooner you determine which are you going to stay in the hospital or hotel, it helps your surgery to be easier on you, easier on us. Another plus to go with us is we offer this package that is covering for complication, for all sort of different things, for $99 only. This is a $400 package that you get to pick for $99. We worked very hard to make this so affordable. Everyone should get this. Again, they always say it's better to have and not use it, or when you need it, don't have it. So please be mindful of MTI. Natalie is our nutritionist in-house. Great person to go get support. Highly recommend post-bariatric vitamins we have, which is Emerge. We have a display in the hospital, but we cannot sell you in Mexico yet. You have to order online and subscribe to it. Is a huge part of the recovery. Again, what we call the honeymoon stage. You all lose weight, but the long-term success depends on your diet, your lifestyle changes. This is a tool you're acquiring. You have to work with your tool to have 100% success. And part of the long-term success is bariatric vitamins. These are made based on ASMBS standards for post-bariatric patients. And it gives you exactly what you're missing post-bariatric. It's not just the multivitamin. Some people just, well, I'll just take multivitamin from the shelves. It's not the same. Certain ingredient of this, you need more, and certain you need less. So you can't do that with a regular multivitamin. It comes in the soft chewable, drinkable capsule. Again, is emergebariatrics.com. You can order it online. So we are getting to the part that I promised for Q&A session. I started answering some of the questions already, and we're going to continue doing that. Some of it is travel related that I cover, and the medical part, Dr. Ceja has got. So this is Dr. Ceja's question. It says, what happens if I continue drinking soda, caffeine post-op?
If the patient continue drink soda after the surgery, the results long term is very poor because the stomach can develop more big after the drink soda, and it's very important avoid this type of liquids, only water or other liquids without gas.
You know, again, I just wanted to mention that, again, this is a tool you acquire. You're getting a new stomach, right? So you have to listen to your body. And I don't think your body is going to ask for those, most like before. So no worries there, you know, you're not, it's like you getting a new beginning, and you have to look at it like that, right? Okay, so the next question Jenny is asking, if I have had ischemic stroke, does that prevent me from having a surgery?
If the patient have a ischemic stroke, it's very important before the surgery cardio clearance, and if the surgery is better in comparison with the risk, the bariatric surgery can be performed. After the bariatric surgery, the patient receive blood thinners and blood thinner for the next weeks when the patient go her home.
How many procedures does each doctor do a day? So the way we manage our surgeons' load day to day, we basically look at the complexity of the surgeries that they assign to them, and we cap it at certain level. Let's say if they doing 3 sleeves and 1 bypass, that's a maximum. But if they do sleeve, you know, maybe we can do 4. So we basically manage the load based on the complexity of each surgery, and we just go from there. Are the rooms private or shared? Almost all the rooms in the hospital are private, but we do have few that if they are coming as a buddies or husband and wife or partners, they can stay together, but we have that option, but most of them are private. Dr. Ceja, this is for you. Why do people get extreme heartburn after gastric sleeve surgery?
The people have or develop acid reflux after gastric sleeve because the stomach is very small and pressure inside the stomach is more after gastric sleeve. And if the patient plus have hiatal hernia, is very common the acid reflux increase after the gastric sleeve. This is the reason, because the stomach is very small and the pressure inside the stomach increase after the gastric sleeve.
Great, thank you. Let me go back. So Kimberly is asking that she did a bypass in 2021 and she is stuck at 225 pounds. And she was told that if she does a mini bypass, she will lose more weight. What is your opinion?
In this case, the best revision surgery for her is a revision gastric bypass. Maybe we can offer a reduce the pouch, the gastric pouch, or distalization of intestine, the both anastomosis. In this case, the better revision is revision gastric bypass. The mini gastric bypass, I consider, is not option for her.
Okay, so that's another question for you. Carolina is asking, does gastric sleeve cause dumping syndrome like bypass?
The gastric sleeve can be produced dumping syndrome, but it's very, very uncommon, less than 5%. It's very frequently in patients with gastric bypass or mini gastric bypass, but it's very rare in patients with gastric sleeve, but it's possible.
Perfect. Another travel question is, I like to drive myself to Tijuana. I'm a few hours away. Can I leave my car in the US side and get transportation to Mexico? Yes. So usually the meeting point is at San Diego International Airport, and you can park your car and just take the shuttle to the airport. Again, all the information that you give our coordinators is in your file, and they look at it and they match you with the driver. They contact you the day before your travel and they make sure you handle right. So no worries. That's why we say, do the paperwork as soon as possible, make the payment as soon as possible. We would take care of everything so you don't have to worry about a thing. We bring peace of mind, and that's our job, okay? But you got to work with us to do that. Okay, so Dr. Sal, you can answer this one. Carolina is asking, I'm worried about getting loose skin. So is there something I can do in the recovery to avoid getting loose skin?
In this case, it's very frequently in patients who have 40 or more years, but in patients, young patients, normally the skin didn't suffer changes after the bariatric surgery. Doesn't exist something or any medicine for that. It's uncertain what is the results about the skin after bariatric surgery. But if you have a problem with the skin after bariatric surgery, maybe you need to consider cosmetic surgery after at least 1 year bariatric surgery.
At least 1.5. We are very careful with the patients. We want to make sure they're not losing more weight, because every time you lose weight, then you get more saggy skin. So, you know, we're very careful, and we're very experienced in handling plastics patients. There are plastic division, which is called MexicoCosmeticCenter.com. You can go in there and submit your health questionnaire. They're very experienced. They handle you the best way, making sure you get a good result without risking your life. So Dora is asking, I get severe allergies during this time of the year. Can I still take over-the-counter allergy medication until my surgery?
Yes, if the patient have allergies known before surgery, of course, she can take this type of medicine after the surgery, no problem.
Natalie is asking, if I do SASI, can I still take NSAIDs again?
Yes, every patient after bariatric surgery can be consumed this type of medicine, but it's very important now you need to take with a specific care, because you can develop complication after you take this type of medicine. But you can take this medicine, but once or twice per day during maximum 3 days, no more, but you can.
So is it okay for patients to take coffee maybe 1 or 2 a week?
Yes, no problem, but you need to wait at least 1 month, 1 month and a half after the bariatric surgery, but you drink coffee. But you can, but you need to wait.
Leah is asking, what's the total amount for surgery in Canadian? Oh, okay. So the prices we are saying is basically in US dollar. I believe it's like a 1 to 1.4, but it also fluctuates. So whatever it is in Canadian, you have to convert it back to US. So so if you say $4,000, for example, that's 4,000 US dollars. So you have to convert it to Canadian. Yeah, so we would send you the pre-op post-op diet the minute you get on the calendar. Again, you have opportunity to text, email, call Natalie. Natalie puts pre-op post-op webinars every 2 weeks or so. So there is a lot of opportunities to learn about what to do for your diet, recipes, and all that. Okay, so that's a question. Is this a clinic or a hospital? So Hospital Azar is a hospital for bariatric and plastic patients. It's not a clinic. As you see, we can keep patients overnight, but that's what. Okay, so as far as the flight, if you have long hours in your flight, first of all, on the way back, make sure you wear compression socks. Also, every hour or maybe less, get up and walk around. Another thing you may want to consider is to stay 1 day extra. whether you stay with us in Tijuana or you can stay in beautiful San Diego Park. So it's up to you, but I would recommend that if you're worried about your long flight home. So basically, after the surgery, you get ice chips, but that's about it. So basically, all the questions you guys have about like which surgery is best for me, we kind of Dr. Ceja went over like in general, but when you submit your health questionnaire, this question comes because the surgeon is going to review your case and tell you this is the best option for you. Again, let's say if somebody is booked for bypass, and you go down there, you talk to the surgeon, and you come up with, okay, maybe sleeve is better for me. We are going to do the sleeve. The fact that you were on the calendar for certain surgery doesn't mean that's a surgery you're going to end up with. We're going to give you what's best for you at the end of the day. We didn't talk about mini gastric sleeve. Dr. Ceja, do you want to touch base on mini gastric sleeve just quickly?
Yes, about the mini gastric sleeve is for patients who have a BMI 30, sometimes a little less 30, 28, 29. In this case, I only remove 50 or 60% of the stomach, but the procedure is very similar to traditional, but only I remove less part of the stomach, but basically it's the same.
Okay, another good question. We still have like 21 questions open. I'm almost 1.5 hours out, so I'm gonna try to make this faster. We're gonna pick the questions to answer. So as far as the passport, we highly recommend taking a passport, especially past few months, they've been very picky about passport. So, just make sure you have a passport card or a passport book to make your transition to US easier. Again, doing these extra steps, it helps you having a good experience, not get stuck somewhere at the border or here and there. All you need is an officer that just didn't have a good day and bang. So as far as the number of nights you need to stay in Tijuana, let's say if you get a gastric sleeve, right? The first night you arrive, you stay either in a hospital or hotel based on our availability, based on your choice. Then you go through 2 nights of hospital stay. So you a total of 3 nights, 4 days. For bypass, will be 4 nights, 5 days. The amount of loose skin is really depends on your genetics, how fast you lose weight, your age, all that plays a role. Whether you exercise or not. That's something, good question for you, Dr. Ceja. How long after surgery should I consider getting pregnant?
Okay, you need to wait at least 1 year after bariatric surgery because this is the time that you can achieve the more weight loss after any bariatric surgery, and you need 1 year after surgery.
Another maybe good question is, what is a leak test? And how do you perform a leak test?
Okay, the leak test is a test you need to take a little sip of a special liquid dye contrast, and after you drink this liquid, the other person technique do a special special X-ray during after the drink the leak test, and we can see how pass the liquid through the bariatric surgery, gastric sleeve, or gastric bypass, and overall see that you don't have a leak after surgery, 1 day after surgery. Sometimes it's necessary repeat the test the second day, but in general, 1 day is enough after surgery.
Okay, something I didn't do was I did not release the Zoom poll like I mentioned, so I'm going to launch it right now. At the same time, we're going to cover some more questions. Please make sure you do that. And then we would pick the winner. Let's get some of these questions answers. While you're doing that, please go ahead and I just released the Zoom poll. Please go ahead and answer those questions. So that's a good one. I have multiple sclerosis and a lower immune system. Can I still get gastric sleeve done?
It depends the evaluation to primary doctor, the neurologist. If the specialist authorizing this procedure, we can do it. Yes, but it's necessary neurologist clearance.
So this Kimberly is asking, I have had problem with constipation, and I think she means IBS issues. Would that be a problem to get the surgery?
Sometimes after the bariatric surgery, this problem can be improved, but it depends each patient. It's very important after surgery continue with the others changes in your lifestyles and continue the diet, but it's very frequently improve this type of problem after bariatric surgery.
Again, please make sure you do the webinar poll so we can put you in the raffle, put your name in the raffle. I already released it. I'm still waiting for like almost a little less than half of people do it. And then we do the raffle, okay? I take tramadol for pain. Can I keep taking it until my surgery and after surgery?
Yes, if you have, if the patient take tramadol after surgery, can take this type of medicine, no problem. Yes.
Okay, so Kimberly meant stomach problems and AFib. She has AFib problem. Is that a problem for getting the surgery?
No, if she have AFib problem, only she needs a cardio clearance before the surgery, and if the cardiologist authorizing the surgery, no problem. I can manage this type of problem here.
So when you do the surgery, I mean, when you submit your health questionnaire, basically, we would take this health questionnaire and run it by the surgeon. And sometimes the surgeon comes back and asks for more tests or things like that. One of them is when you have heart condition. They want to make sure you go there and you get it done the proper way. Now, sometimes if it's difficult for you guys to do, let's say the heart clearance, cardiac clearance, or things like that, you have option to come to Mexico and redo it. But you have to remember that there is no guarantee that you pass that test, and if you don't, we're not going to do the surgery. So we offer you like a package to say, hey, this is for the cardio clearance, and if you pass, we include it in the surgery part of it, and you get the surgery done. If you don't, you just go back, but you just paid for the cardio clearance. That's an option that a lot of the people select to do. So that's an option for you to explore. I'm going to Okay, so I think we have the name of the winner of our raffle for today. So let me go to the attendees. Make sure. Okay, there we go. Okay. Okay, so the name of the lucky winner is Cynthia Atkins. Cynthia Atkins. Let me see about. Okay, there you go. Cynthia, I'm going to let you talk. Please go ahead and speak to us. Hello, Cynthia, do you hear me? There we go. Cynthia, you're still on mute. If you can unmute yourself and tell more about yourself. Cynthia, do you hear me okay? I'm asking you to unmute yourself so we can talk to you. Anyhow, congratulations to Cynthia Atkins. I'm not sure if she has a problem talking to us. Please contact us for getting on the calendar, and you're the lucky winner. Thank you so much for everyone else to participate and taking time to join us. These are all great events. Again, our surgeon, Dr. Ceja, thank you so much for attending, and we see you next time. So we see you guys either in hospital or next time. Thank you so much, and you guys take care. Goodbye.